Welcome to the ADAA webinar, Marijuana and the Adolescent Brain, Our Teens Self-Medicating Their Anxiety. What are the potential long-term consequences? I'm Suma Chan. I'm an associate professor in the Department of Neurology and Psychiatry at St. Louis University School of Medicine. I'm a clinical psychologist specializing in cognitive behavior therapy. I'm a member of the ADAA Public Education Committee. I'm your host this evening for the webinar presented by Dr. Amir Levine. At the end of the presentation, we have the interactive Q&A part of the webinar when we'll be able to answer some of your questions. On the right side of your screen, you should see a Q&A panel. There's a little field at the bottom of that panel, and when you click in it, you can type in a question. Then either hit your Enter key or click the icon. You can type in your questions at any time during the webinar, and we'll try to get to as many as possible. Other participants cannot see your questions. We may not have time to get to your individual question, so we apologize if that is the case. We'll also be recording this webinar to make it available on the ADAA website at a later date. We are broadcasting, so we cannot control your individual audio or visual computer settings. Today we'll be hearing from Dr. Amir Levine. Dr. Levine is an adult, child, and adolescent psychiatrist and neuroscientist. He is an assistant professor in the Department of Psychiatry at Columbia University and works in the Division of Child and Adolescent Psychiatry. He also has a private practice in New York. Dr. Levine has carried out research on marijuana and its impact on adolescent psychopathology, as well as its use for medicinal purposes. He has a special interest in how changes in the brain during adolescence pose greater risk for the development of addiction and mood disorder. He has also published a book in a very different area, but an interesting one, The Science of Adult Attachment. Before we begin this presentation, I'd like to tell you about ADAA. It was started in 1979, and today it is a leading nonprofit dedicated to increasing awareness and education about anxiety disorders, depression, obsessive-compulsive disorder, post-traumatic stress disorder, and related illnesses. ADAA's mission is to improve diagnosis and promote the prevention, treatment, and cure of these disorders through education, practice, and research. ADAA fights to end stigma by promoting the message that they're real, serious, and treatable. Please visit the ADAA website, that's www.adaa.org, which includes Find a Therapist, a searchable database of treatment providers, as well as free educational information and resources, self-tests, self-help groups, clinical trials, and a lot more. You can support ADAA's efforts, such as this webinar series, by making a charitable contribution on the ADAA website. Remember, you can type a question at any time. Now let me turn it over to Dr. Levine.
Oh, hi, thank you. Thank you very much for this kind introduction. It's a pleasure and an honor for me to have this opportunity to give this webinar to you today, and thank you everyone for joining us. The title of the webinar is Marijuana and the Adolescent Brain, Our Teens Self-Medicating Their Anxiety. What are their potential long-term consequences? And I want to start with a little vignette of one of my patients. She's a 26-year-old woman who came to see me. She's a successful artist, but she complained that she felt that everything is pointless. And she really lacked motivation. She had a hard time starting the project because she felt that, what's the point? She also complained that she had trouble focusing. And interestingly, she had a history of social anxiety. And as a teenager, she used marijuana as a way to manage social situations. And my patient is not unique in her anxiety. Actually, anxiety disorders is one of the most prevalent psychiatric disorders among adolescents. And about 8% of adolescents suffer from anxiety disorders. but only 18% of them will be treated for their symptoms. So the vast majority of them, about 72%, will remain untreated. So the question remains, what happened to these 72%? And I will argue that they probably find other ways to treat those anxiety symptoms and probably self-medicate themselves. And as we know, so what happens to these 72%? As we know, nowadays nowadays marijuana is becoming more and more accessible and more often seen as medicinal. So it will actually be more of a reason to think that many teenagers and adolescents will turn to marijuana to help them self-medicate their anxiety. And indeed, attitudes towards marijuana are changing rapidly. And according to a Pew Research poll that was done in 2013, whereas in 2006, 50% of people believe that the use of marijuana is immoral, only in 2013, only 32% thought that the use of marijuana is immoral. So there's a huge change in those years, and as well as also in belief that marijuana is a gateway drug. In 1977, 6 out of 10 people thought that marijuana is a gateway drug, whereas in 2013, only 4 in 10 people think that marijuana is a gateway drug. And as a result of these changing attitudes, there's also changing attitudes about the decriminalization of marijuana. And the vast majority of millennials, people who were born after the year 2000, 65% of them are in favor of legalization of marijuana, where only 54% of Generation Xers actually support the legalization of marijuana. But still, that's the vast majority, even among Generation Xers. So if this trend continues, we expect to find that eventually it's inevitable that marijuana will become legal across the United States. And at this point, 17 states actually allow marijuana use for medicinal purposes, and then Washington State and Colorado also allow recreational use. But whether it's legal or not, adolescents are already commonly using marijuana, and about 50% of high school seniors have tried marijuana in their lifetime, and nearly 40% of seniors have used marijuana in the past year. And I think the most striking number is that about 7% of seniors in high school, which is 1 in 15, use marijuana daily or almost on a daily basis. And pay attention to this number, the 7%, because if you remember, I told you earlier that 8% of kids have an anxiety disorder, and only a fraction of them are being treated. And so you ask yourself, who are these 7% that find that they need to use the drug on a daily basis, and are they potentially self-medicating something as opposed to just using it recreationally with friends? So they have this need to use it on a daily basis, and we ask ourselves, why is that so? Apart from this use, we find that also potency is also really increasing, and the marijuana that exists today is really not the marijuana that existed even in the 90s, and certainly not in the 70s. And the active proportion of marijuana, the component that gives the high or the psychoactive properties, is called tetrahydrocannabinol, or in short, THC. And whereas in the 70s, marijuana, the content of THC was about 4%, in the 90s it went up to about 10% to 20%. But now breeders have been able to breed higher and higher content of THC into the marijuana plant, and we have plants now that actually we can reach the concentration of THC of up to 40%. But even that's just the beginning of it, because there's new methods of consumption of marijuana that include oil and something that's called butter, like butter, but it's butter. It's kind of like a soft, gooey material that actually has up to 70% THC content, and shatter that has up to, which you can see in the picture here, that has up to 80%. And shatter is also, it lacks the terpenes, which are aromatic oils that give marijuana its typical smell. And so when people use shatter, like in e-cigarettes, but they're only used for marijuana, it's completely odorless and undetectable. So this is a major change and shift in the way that people are using marijuana, and it's really opening uncharted territories, because we don't really know how such really intense, really high concentrations affect the brain and what are the implications of use of such high concentration. Marijuana has never been used in such a way. So this is all very new for us. And there's another issue about that, and that is that specifically THC or marijuana may cause harm to the developing brain, because there's some studies that link early use of marijuana to negative long-term possible permanent consequences. And it was found to potentially negatively affect brain maturation. So the question is, and that's mostly found in adolescents, in children and adolescents, and not so much in adults. And so the question is, why would children and adolescents be at a greater risk? Why may adolescents be more vulnerable? And in order for me to explain that, I need to give you a little crash course in adolescent brain development, or in brain development in general. And there are two times in our lives where the brain develops exponentially, and that is after we're born, and that is in the first 2 years of life, and then later on in adolescence. And what happens in adolescence, the brain actually shrinks. It loses a lot of its gray matter. As you can see here, the darker color actually portrays a reduction in gray matter. And we can see here starting at 5 years, and this is all imaging studies. This is the preteen brain, and then you move on over to the teen brain, and at 20 years, you see a huge reduction in gray matter. So the brain actually shrinks, but what we don't see here is that what does increase is white matter. So what that means is that the brain actually becomes more efficient, and it's actually able to lose some of the neurons that we don't use as much, and actually take the neurons that we do use and make them more efficient, and being able to fire more efficiently and communicate with other brain areas more efficiently. So if you want to think about an analogy, it's as if the brain is getting rid of small roads, and instead it builds like huge, big highways of communication between different brain areas. And what that means is that eventually, when that happens, the adolescent is able to do things that they were never able to do before. And a lot of executive functioning kicks in. And all of a sudden, adolescents and teenagers are able to think abstractly. They're able to solve more complex problems. They start asking who they are and what is the point of being in the world. All these like really symbolic thinking. And that all is really a result of these processes that the brain undergoes in adolescence. The other thing that also undergoes huge changes is the endocannabinoid system. And so the endocannabinoid system is what marijuana, the THC marijuana, is working on. There are specific receptors in the brain that actually really take care of a lot of different functions in the body, energy and metabolism, and also the function of other neurotransmitters. It's a very important system for cognition and for emotional well-being. And so what happens in adolescence is that this system also is in flux. And the number of receptors, the endocannabinoid receptors, changes dramatically and it rises and rises with age. And a very well-known, I think, principle in development is that when you actually intervene, when there is exposure, when the system is in flux, it may change the trajectory of the system and cause a different baseline of maturation in adulthood. So potentially exposing the brain to THC in adolescence may change the trajectory and may actually result in a different baseline in adulthood. So we also find that to be true in terms of brain structure. And imaging studies that were done looking at the brains of people who were exposed to marijuana from early on find some brain abnormalities. They found some abnormalities in the shape and the density of the hippocampus, which is this. Let me show you with this. To move in the hippocampus, which is this area in the brain. And the red actually is portraying like the connections that are not as good as the connections that are in the controls. And the hippocampus is really important in terms of memory and learning. They saw differences in the amygdala. This is the amygdala, which is responsible for fear and emotional learning. And also in the nucleus accumbens, which we don't have here, but the nucleus accumbens is important in motivation and reward. And these brain abnormalities also coincide with some impairment. And especially when people are exposed earlier on, we find that there is a decrease in cognitive functioning, and people have problems with attention and memory, as well as executive functioning. And in terms of this, I want to show you this one study that looked at early exposure and measured executive functioning and sort of FAB measures executive functioning, the whole battery of tests measuring executive functioning. And what we see here, these are adults, people are around the age of 30, and we see here that if there's an early use, we see an impairment in executive functioning, whereas if people were to use later on, they're indistinguishable from controls. So it seems like early use is associated with some abnormalities in functioning and cognitive functioning. But not only cognitive functioning, also emotional functioning. So other studies have found that early use is associated with lack of motivation, with increased risk for anxiety and depression, and also potentially early onset psychosis for people who have a predisposition for that. And also early use also predicts potentially future problem use of marijuana and also problem use of other drugs and greater chances of becoming addicted to other drugs, and an overall decrease in life satisfaction. But the question is here, the only thing, so I showed you all these slides basically hypothesizing that perhaps early use is associated with impairment. But we don't really know that according to these studies. These studies cannot establish that because we don't really know whether people who start to use earlier have these underlying problems to begin with, which causes them to use earlier on. And actually the impairment that we see is not due to marijuana, but it's actually due to some underlying problems. So it's more like of a chicken or an egg problem. Is early exposure to marijuana the culprit, or is it the existing impairment that leads to early use? And what can really help us decipher that and give us some insight into that is animal studies. And animal studies allow us to establish causality and study molecular mechanisms of potential harm and what happens in the brain. And in animal studies, for example, in mice, we can take inbred strains that are all genetically identical, and the only changing variable is administering marijuana. So we know for sure that there's nothing else, there's very little else, I should say, that is actually changing. And some of the findings of these studies actually suggest that marijuana may harm the adolescent brain, specifically and more so than the adult brain. And I want to show you some of these studies. And actually, they're very parallel to some of the human studies. So a whole group of studies have found that if you expose an animal, so I'm showing pictures of people, but it's really more, all these studies were done in animals, and it's really a big question mark about it. It's also causal in humans. But when you expose animals to marijuana in adolescents, it seems to interfere with the function of the hippocampus. It actually interacts with glutamate, which is a neurotransmitter which is responsible for memory and learning, and interferes with its functioning, leading to memory and learning impairment. And this is also true long after the marijuana has been discontinued. So in these mice or these rats, they expose them in adolescence to marijuana, they stop it for several weeks, which is a very long time in the life of a mouse or a rat. So typically live several years. And then they test them. And they see that despite discontinuing the drug for a long time and allowing for some recovery, something has changed at baseline in their brain, and they still show impairment in learning and memory and cognitive impairments. We also see in these animal studies impairment in emotional functioning. And rats that have been exposed to THC, so this is more specifically THC, in adolescents display decreased willingness to seek favorite food adults. So you really have to sort of get into the brain of these rats and these mice. So most of what they have in their life is food, and they love, like when they have certain treats, they would go to a great length to get those treats. And so that's what these studies test. They teach rats to press levers or mice to press levers in order to get their favorite treat. And they make it harder and harder. They have to press harder and harder and longer until they quit. They wanted to see when they quit. And they find that these animals, when they were exposed to THC, when they were adolescents, they really were not as willing to work hard to work as hard for those treats. They really gave up quite soon. So that really suggests that they really lacked the motivation to work hard to get something that they like. But also perhaps there's another reason. Maybe they actually are not even enjoying those treats as much, and that's why they're not really willing to work as hard for them, which is something that we compare to in humans, anhedonia, is the inability to enjoy life to the fullest, or to enjoy the things that are enjoyable in life. So we wonder also, how does that translate to humans? What does that mean in a human life? Other animal studies have found that for animals that were exposed in adolescence, there was an increase in anxiety and depressive symptoms in adulthood, and also a disruption in startle response. So you can sort of try to startle them, and they never stop. They don't get used to that. They basically continue to startle all the time, which is something that is the scientists see as something that's mimicking the propensity for psychotic symptoms. Other really interesting things that we find in animal studies is that there are also gender differences in response to adolescent marijuana exposure. And the NIH is now putting a lot of emphasis on looking at gender differences. And historically, a lot of research has been done in men and also male animals. But nowadays, there's a shift to really look at the differences between males and females, because especially as it relates to addiction and drug use, but in many other things too, there are quite a few differences. And one very elegant study was able to find great differences when adolescent animals were exposed to rodents, were exposed to THC. And they found that female rats are much more sensitive to the effects of marijuana, both acutely. So in the acute phase, they exhibited greater anxiety and more pronounced impairment in working memory. But also, in terms of long-term, even after the drug has been discontinued, females actually showed greater impairment in working memory, in special learning, in motivation, and greater signs of depression. So there's a question, and I think we have to do more studies to see whether females are more sensitive to these effects of adolescent exposure to THC. Another interesting finding from the animal studies is that adolescent animals can tolerate much higher doses of THC. So it's very important how people respond to the initial doses of THC, and the initial response, whether it's favorable or not, is a very strong predictor of future use. So if people have a bad initial experience of almost any drugs, they tend to try to not use it again. And especially with marijuana, if it's consumed in medibles, which is basically foods that contains THC, contains marijuana, people don't really control how much they're ingesting, and then what happens is that when finally the high hits them, and if they're not used to marijuana, they can become quite sick. And there's actually been a spike in emergency room visits in states where marijuana has been legalized for recreational use, because people don't really know how much they can consume initially. But this study actually found that, very interestingly so, that adolescents have a much higher tolerance to that initial dose of marijuana. They can consume a lot more and not feel as sick as adults. It's almost like a double whammy, because it's the period of time in their lives where their brain is most sensitive to marijuana, yet their bodies, they don't get as sick as adults do, so their body can really warn them, you consume too much. But we know that in animals, this is still needs to be looked at in humans. We still have many unanswered questions. I think we don't know what is the mechanism by which marijuana potentially harms the adolescent brain. We also don't know if there's a particular age in which the brain is most susceptible. Is it 12? Is it 11? Is it 16? When is it safe to use marijuana? When is the impairment? When can people start using marijuana without fearing impairment? And also, can we reverse or prevent some of the harm? If we understand the mechanism, then we have a potential of intervening and potentially reversing some of the harm. And also the other question is, can marijuana be helpful? Because obviously in 17 states it's approved as for its medicinal properties. And also lately in the press there's been some talk about children treated for seizure disorder with marijuana and other potential ailments. So does marijuana have a therapeutic value? So in order to understand that, we first have to understand that marijuana is not a single drug. And as I mentioned before, the best known constituent of marijuana is the tetrahydrocannabinol, which is THC. But there's another constituent with immense therapeutic potential, which is cannabidiol, which is also known as CBD. And CBD is a cannabinoid antagonist, a deactivator, which can lessen some of the effects of THC. And THC is actually an agonist, which is an activator of the receptors. So they kind of like work against each other. And this would explain why most breeders have historically tried to create strains of marijuana as high in THC as possible and as low in CBD as possible. But actually, research now, and we have some findings that CBD has immense therapeutic value. And in this table, you can see some of its therapeutic effects. Apparently, it rescues memory and learning impairments, and it's been tried in some people with Alzheimer's. It has actually much greater anticonvulsant activity than THC, and that's so when people talk about the anticonvulsant activity of marijuana, it's really the CBD that's contributing the most for that. It also helps to decrease anxiety, and also it helps decreases symptoms of psychosis. And if you look at THC and what is THC really good for in terms of its medicinal value, there's two main things that THC is really good for. And one is for pain relief, which is actually then very superior to CBD. And also, show you like here with this. Okay, put the pointer. Oh, doesn't work. But also with appetite down here at the bottom. You can see that THC actually increases appetite. So though THC would be really good for patients who suffer from pain and have decreased appetite, like people who have been through chemotherapy and other illnesses. But CBD has its own list of things that it's actually really good for. So I want to go back to my patient for a moment. And now with this all this information in mind, we can see some of her complaints in a little bit of a different view, because maybe the lack of interest, the feeling that things are pointless, can be more or less of an anhedonia thing. And the difficulty focusing, which can be a cognitive impairment, is a result of having marijuana used during adolescence. And could she be affected more than if it were a male patient, because she's a woman and maybe she's more sensitive to that? But we really don't have all the answers to that, and we need more research to answer this question. And then potentially also, like one animal study has actually shown that if you use certain medications for, like we use for ADHD, that helps reverse the impairment, the long-term impairment of marijuana exposure in adolescents. So all that really still remains to be studied, whether we can reverse some of the damage that's been done, because I don't really think that we'll be able to stop all teenagers from smoking pot and using marijuana. And really understanding better mechanisms can really inform us of new interventions and new treatments. And I want to really thank all the people who helped this webinar to make this webinar possible. And with that, we can go to questions.
Dr. Levine, we have a couple of good questions here.
Okay.
One of the questions is that, is there a correlation between parents' use of marijuana and the teen?
So I think especially when parents are using marijuana openly in the house, it's much more inviting for teens to use. And it's just, because the attitudes are changing so rapidly, I'll just tell you an anecdote that I heard of a family that I know in New York, where where the parents have always been great proponents of using marijuana, and now they basically get together with their children, their adult children, and they have, it's almost like drinking wine together. They basically like smoke marijuana together. So it's becoming more and more, it's really, the attitudes are changing markedly, and now people start to see it more as basically like drinking alcohol.
Another question is, what is the age that you're referring to in that study when the term early use was mentioned? I think.
So let me go, maybe I can go back there. Yeah, I can go back. So it's interesting, I didn't mention the age, but actually in this study, the age, the cutoff point was 15. So for some reason the arrow doesn't work. Anyway, the pointer. But in the first column, where they do have the early onset, it's actually people who started using before the age of 15, and here it's people who started using after the age of 15. But it really doesn't, it's just one study. It doesn't, I want to be cautious about it. And I don't want to say that, oh, you can starting smoking marijuana after the age of 15 is safe. We just don't know that. And other studies have shown different ages. And that's why I said, well, we need much better studies and larger studies. This is, I think there's only around, it wasn't such a big study in order to really try to understand when is that window of vulnerability.
Another question, are there racial, ethnic differences regarding reasons for use or effects of marijuana use? Are there any studies which would talk about that?
About racial?
Racial or ethnic differences regarding reasons for use or effects of the marijuana use?
That's a very good question. I mean, I know about the differences in the gender differences, but and I'm sure that's been studied. I'm not that familiar with the studies that look at racial differences in marijuana use. I know that in general there's been big shifts and changes in marijuana use, and now in the past several years, actually marijuana use among teenagers has eclipsed the smoking cigarettes. So now more teenagers are actually using marijuana than smoking cigarettes, and that's due to some rise in marijuana use among teenagers, but it's actually even more so due because there's more of a rapid decrease in smoking. The smoking is decreasing, but the use of marijuana is on the increase, and now actually some teenagers use more marijuana than smoke.
I think we have two questions on the same area. Is there a general definition of heavy use? One person has asked. Is it a daily? Has it been daily for years, months, sporadic for years? You know, what exactly would you say is heavy use of marijuana?
Right. So I wish the studies that it would agree between them, because I think people set a different set point in different studies, and that's better if the studies were would agree of a certain parameter. But I think most studies look at heavy use as something more or daily or nearly daily use, and the other type of use is more sporadic, maybe once a week, a few times a month. But that would be like the most, like the biggest. So I think the heavy use is mostly daily, almost daily use.
Another interesting question, in animal studies, how does the impairment from THC compare with impairment from benzodiazepines? Are there any studies that have looked at that?
So that's an interesting question about benzodiazepines, because I guess that's something that people use to treat anxiety, but actually we don't really use so much benzodiazepines to treat anxiety in adolescents. I mean, we do in the short term, but really the medications that we use for adolescents for anxiety, first of all, the first line of treatment oftentimes is basically actually therapy, and then we use also the SSRIs. But the benzodiazepines, in terms of the long-term side effects, I think they're considered safe in adolescents, but I'm not sure exactly about how they would sort of shape up in terms of like head-to-head comparison to marijuana. But I'm not aware that they would cause such an impairment. What does actually is almost head-to-head with marijuana, and it's actually alcohol drinking. And that there are many, many studies that show that also exposure to alcohol to the adolescent brain may actually have long-term consequences. So really, the adolescent brain is a very, very sensitive brain, and exposure to drugs is not, especially not a good idea. It's a time when things are consolidating, and it's really like I think I like to call the adolescent brain the brain of opportunity. And if you give it the right opportunity, it can actually learn. So it's shaped by the environment. So if you expose it to challenging things that adolescents have to learn, new techniques and new skills, they can learn it very well. But then if you challenge it with substances, it has a detrimental effect.
Now the question for you is about the withdrawal symptoms. Can you elaborate about what are the types of withdrawal symptoms that a person can expect as he or she weans off from the marijuana?
Okay, I think that's a very important question, because this whole issue of withdrawal from marijuana is very, very new. It's only something that became part of our medical understanding in DSM-5 that just recently came out. Before that, there was not enough scientific evidence to actually coin a specific symptom, withdrawal symptoms. But now we do have this understanding that withdrawal from marijuana does exist, and it has several criteria from DSM-4. First of all, it really usually happens when there's cessation from marijuana use that's been heavy and prolonged. So almost like on a daily basis or every day, just like heavy and prolonged. And then within several days after people stop using, there could be certain symptoms that may become apparent, such as irritability, anger or aggression. So that's one symptom. Maybe nervousness or anxiety. There could also be sleep difficulties, such as insomnia. Interestingly, there could be actually decreased in appetite and some weight loss, and a lot of restlessness, some depression, and also some potential physical symptoms that can cause significant discomfort, such as like stomach pain, shakiness, tremors, sweating. People can have fevers or chills and headaches. So nowadays, we really recognize that that marijuana actually can cause withdrawal symptoms, and I think that's very important, because once people start using on a daily basis, like we saw like 70% of teens do that, if they try to stop, it makes it very hard for them, because they go through this horrible withdrawal. They may go through these horrible withdrawal symptoms, and there's like something that can make it all go away, which is basically consuming, using pot again. So that leaves them kind of like tied to this drug. So I think that also is something that we really have to worry about.
On a related note, another question here is, what would you say to a teenager who's using marijuana for anxiety?
So I think I like the way that I like to look at it. It's like if I were to tell you, okay, I'm going to give you a medication for anxiety, but it will leave you less capable, like in a few years from now, it will leave you less capable. You're not going to you're going to be have a harder time learning. You're going to potentially have less motivation, enjoy life less, and in general just potentially have more anxiety and more depression. But it will help you in the here and now. Would you want to take it? I don't think so. I think it will be much better to take something that's safer, that has been studied longer. So, for example, we have, first of all, the first line, like one of the first lines of treatment for anxiety is psychotherapy. So without taking any medication, people can really benefit, and I'm sure, as you know, I mean, you're an expert in CBT, can hugely benefit from treatment for anxiety. And these, like, we teach them skills that stay with them for a lifetime. This is something they take with them into their adulthood, and they're skills that are very useful in many, many aspects of life. And then they also need medication, because actually it's the combination of psychotherapy and medication that has almost 80% effectiveness, and that's huge. We treat with a SSRI, such as Zoloft, or sertraline, actually. And And that has been shown to be obviously much safer than, at least from what we know now. Still, I mean, I'm not ruling out completely marijuana because as we saw, that CBD may actually have immense abilities of treating anxiety, but we still have to study more. And I think in some instances, they're working on strains that are very high in CBD and low in THC, and potential also medications. I know that there's some companies that are patenting that. So I'm hoping that in the future, I think that marijuana has immense therapeutic potential, also for anxiety, specifically CBD, and I'm hoping that in the future, we can see more of that.
Yeah, another question is marijuana still considered as a gateway to other drugs?
So I'm glad you asked me that because we saw, like in the Pew poll, they said that in the 1977, 6 in 10 people considered marijuana as a gateway drug, whereas in 2013, only 4 out of 10 people. Let me just go back to the last slide. Oh, that's the first one. Let me go to the very end. 4 out of 10 people consider marijuana as a gateway drug. And I think that, so it's very controversial. It's definitely, if you look at the statistics, the vast majority of people who use illicit drugs also have used marijuana at a certain point. But I think a lot of that has to do with psychosocial factors. The fact that marijuana is more easily to get, it's more accessible, and attitude stories that are changing, it's more permissible, it feels like something natural, whereas other drugs, illicit drugs, are not. And in some states, it's not even an illicit drug anymore. So, but I think, actually, in my work, I did some basic science work. I found that if anything, it's potentially nicotine and smoking, nicotine specifically, that is more of a gateway drug. In my work, I actually found that nicotine has a specific effect of the DNA in the nucleic accumbens in mice, and it opens up the DNA in such a way that then when another substance comes along, such as cocaine, there's a much greater gene expression of genes that are responsible for addiction. So that's a very unique property of nicotine that I found in animal models. So we don't know about marijuana, whether it can do the same thing, whether it can enhance the effect of other drugs, but we do know that about nicotine. So that still remains to be seen, but I think that less and less people see marijuana as a gateway drug.
There's a question here somebody has asked about, I think she wants to know about if there are any studies which have looked at what extent adolescents use marijuana to self-medicate, to relieve symptoms of anxiety or depression, PTSD, what proportion?
Right, exactly. So that's why I showed in one of those first slides that, in my opinion, I think most of the teens that use marijuana to self-medicate, they're like the most likely to engage in heavier use because they're the ones that suffer from symptoms on a daily basis, and so they'll need to treat those symptoms on a daily basis. I think in some ways it's almost like a vicious cycle because we can see, as we can see here from this table, what happens with marijuana when people, with THC specifically, when people smoke it and they're anxious, their anxiety will decrease when they're high, when they're intoxicated. But then with the withdrawal, like I told you about the withdrawal symptoms, it can actually increase. So then they're caught in this vicious cycle where they're actually not just only self-medicating their anxiety or depression, they're also caught in this endless cycle of having to sort of feed into that withdrawal or the withdrawal side effect. So that is very worrisome. But I think, especially now for teens, I think for them, it doesn't feel very cool to go to therapy. There's all the stigma that's involved with that. It's cool to smoke pot. And also, people have this whole idea that it's an herb, that it has medicinal properties. But I think people really have to be more informed in terms of medicinal properties is, we don't just say about anything that's good for everything. We don't think that Tylenol is good for everything. We have to really be careful and think about what is it good for and what is the content, and not every marijuana is the same thing. There are different strains with different capabilities and different content. And beyond even THC and CBD, there are a lot of other substances that we're still learning about that are in that could potentially be therapeutic in marijuana.
So on a related note, there's a question about CBD, the CBD component of marijuana, whether it makes a person feel high if it is consumed?
It doesn't at all. If anything, so it's an antagonist. And so if anything, it takes away from the effect of THC because it blocks the receptors and THC cannot bind to it. So it has no, I'm sorry to say, but it has no psychoactive properties of making people feel high. For good or for worse, for better or for
worse. Somebody wants to know how is butter consumed. Is it like an oil or how is it consumed?
So I wish I had a picture. There's like, you can actually obviously Google it and see so many pictures on the internet. Some people are very I think people have a passion for marijuana and also in general, like when I looked, when I was working on this webinar, you can see there's even like kids books about parents using marijuana. But really the whole way that people are seeing, the whole narrative about marijuana is changing dramatically. How batter is consumed, I think it can actually be used for medical, in food. I don't know if it can be actually, I think you need to use shatter to smoke in those e-cigarettes, but I'm not sure. But certainly in medical, the good thing about butter and shatter as opposed to oil is that there the concentration of THC is controlled. In oil, it's very unreliable. And so I know that nowadays, especially in places where the marijuana has been approved for recreational use, there's been a lot more, there's a whole industry that's growing around medibles and having like pastries and foods that have marijuana in them. And I think now they're talking about coming out with cookbooks that will teach people how to cook with marijuana. So the legalization is coming, and I think it's going to be very important to really know that, okay, it's probably inevitable and marijuana is going to be legal, but we're on the verge. We really need a lot more. We need to study it more. We need to know more because we need to prevent potential harm. And I think people underestimate technology and the role of technology in drug use. But just think about what happened when we had cocaine for many, many years, but then crack came along. And that totally changed the whole addiction to cocaine and how cocaine is consumed and everything that went along with it. And I don't want to be an alarmist. I'm not saying that this is similar. I'm just saying there's a different technology here. And it's going to change everything that I think the way that people use marijuana, the way that it influences the brain. And I think it's better to study it sooner rather than later.
Right. So I think we have run through most of the questions. One person has said, thank you, that was very interesting, and I agree. So I would like to thank all of you for attending the webinar and Dr. Levine for his excellent and very interesting presentation. You'll receive an email to let you know when a recording of this webinar will be posted on the ADAA website. One person had asked for a copy of one of the slides, so it will be available on the ADAA website. We hope this was helpful. Please let others know about this series and consider making ADAA. Thank you very much, and good night.
Thank you, everyone. Thanks a lot.